The best paymaster here is probably pharmaceutical industry. If you land up in a very good MNC, probably you will look somewhere around.
So, sir, can you walk us through the typical pay scale that how does the compensation across various fields that we have been talking? The first thing we talk about academician, being into the pharma corporate and the research government, and again the consultancy and the entrepreneurs. So, can you
Yeah.
please walk us through the typical pay scale that ranges across these domains?
Yeah. This is basically, very subjective. So probably I'll just use my own analytical skills to help you with the range. So the best paymaster here is probably pharmaceutical industry. If you land up in a very good MNC, if they are doing really good, if their molecules are really doing well in the market, probably you will look somewhere around 19 LPA, 19 lakhs per annum in Indian rupees, not in dollars. Especially, I know in Western market, probably I have heard people getting, very good numbers. But in India, probably that's where you will look 18 to 19 lakh per annum. And if you are really good, probably you will touch 20 lakh per annum as a beginner. And pharmaceutical industry, they'll give increment depending on their revenue and depending on their growth and achievements, and that increment will be always around 10% or 15% if you are really good. And if you want to explore some other option, then you can change your company, and then probably you will get very good hike like 30 or 40%. I heard people getting 50% hike, and your numbers will definitely increase going forward. And there is academics is, they always maintain the plateau, and there'll be, increments once in a while as per your designation. And you will join as SR, you will somewhere get, monthly 1 lakh in hand, and then it will increase. If you are assistant professor, probably you'll get 1 lakh 50,000, depending on the region as well. Some of the metro cities, they will pay you around 1 lakh, whereas if you go to second tier cities, or maybe some of the private medical colleges in different places in India, they will offer you 1.6 to 1.7 lakh per month. And this goes. And probably central government, again, they will also pay you around 1.5 to 1.8 lakh with all the incentives and lot of benefits. So you can say close to 20 to 25 lakh per annum as the initial salary, and it goes beyond, depending on your talent. If you are really good and if you are really versatile, dynamic, industry will take you anywhere. You will become, leader, or you will become a director. You will become vice president, and if you become vice president, numbers will be crazy. And I should say, like, I've heard people, especially people who runs or controls medical affairs, or those who are the boss or vice president of clinical medical regulatory departments, they will get somewhere around 1.5 to 1.5 to 2 crores per year. So you just do the maths. So
Yes.
this is how the money works, and everything. Ultimately, you need to have very good skills, and you need to improve year by year, and you need to have a very good rapport with your colleagues. And if you do well, if everything goes well, as I said, company also should do well. If everything goes well, then numbers will be upwards, and you will definitely, it is almost as far as any clinical subject, I should say.
Right, sir.
Yes.
So, sir, I think we have almost discussed everything about careers after MD pharmacology. Now, moving to our next segment, that is very important considering the phase that our audience is going through. So now they are like we assume that they are someone who are appearing for NEET PG. So they will be having 3 years in the MD pharmacology. So they want to know about the insights, how the life in residency works. So, sir, can you describe what a typical day during MD pharmacology during your time of residency looks like?
Yeah. So a typical day includes attending lectures. If there is any MBBS classes you will just attend. Maybe if our senior professors are taking, you will just have to attend it and learn. It is not mandatory, but I would always love to attend any of my senior faculty's lectures because they will bring a lot of perspective into this, and I used to get a lot of historical facts, learning about science or learning about the molecule, learning about pharmacology in a different ways. And attending lectures will be your early morning thing, 8 to 9 or 9 to 10, like that. And post that, you will have to take class to allied sciences. Like there used to be BSc nursing, BSc MLT, medical lab technology, and multiple such courses used to be there, like emergency medicine. And for those technicians, there used to be pharmacology subject, and they used to put duty roster for our MD, you know, post graduation students, like first year, second year, third year. We used to do a lot of such classes, and those who are not having those classes, they'll be doing laboratory experiments or animal experiments in the department, and they'll be busy in labs. And we will be spending that time in bioassays or rat experiment or rabbit experiments or guinea pig experiments. And by then there'll be lunch, and post lunch we will take practical sessions to our undergraduate students, and computer assisted laboratories, or maybe OPSIs, or basic pharmacology, like clinical pharmacology experiments, and so on. And once you finish that, we there used to be a lot of journal clubs inside the department. Once in a week, we need to present to our faculties when there are multiple PG students and PhD students. And those JCs used to be really interactive, and you will get a lot of skills. Probably I was someone who had stage fear initially, but those JCs made me what I am. Today I love presentations. I have done presentations across India in multiple states, multiple medical colleges, to senior doctors or anybody, pediatricians, hematologists, and endocrinologists, and so many people with confidence. And especially I should thank those journal clubs and those presentation. There used to be critical thinking presentations to medical students as well, and I should thank JIPMA for it, because those were creative presentations. And there used to be debates inside the departments. There used to be one set of MD students sitting on one side, other side there will be PhD students, and other set of faculties. We used to fight for a couple of molecules, especially when it comes to their efficacy or safety, dissecting the paper, understanding the biostatistics, and what are the limitations, trends of those articles, and you name it. Those presentations used to be there around 4:30, and by 5:30 or 6 we used to finish all our things. And if you have some thesis related work, for example, I used to do research on aspirin resistance. I used to go to endocrine department to collect blood samples from the patients who are fitting into our inclusion criteria. And I used to go to OPDs, endocrine OPDs, to see the case reports, sit with endocrinologists. They used to be my co-guides, and select the patient, collect the blood samples, come back to department, store it. And if I'm free, labs used to open overnight. I used to take the keys. I used to go to department post dinner, sit there, do or run RT-PCR or any of the laboratory experiments, do the gene extraction, DNA extraction. So it used to be very busy, but there used to be a lot of free time. I used to have a lot of free time. I participated in residency, junior JIPMA resident doctor association elections. I used to take part in couple of events, programs, and it used to be really fun. That's how my typical day used to be, with all the experience. I think I took a lot of time, but this is how I just it gave me opportunity to revisit and reminisce my memories. It was really nostalgic, and that's very interesting, day to day affairs for any typical MD pharmacology resident.
Right, sir. So, sir, what do you think are the major subjects or area of focus that a student study during residency, and can you explain also in short, the meaning about it?
Sure. So there used to be clinical pharmacology, and we had MDM clinical pharmacology department separately, and they will do a lot of clinical trial related work, and they will have postings in different specialities. They'll go to neurology department, they'll go to oncology, they'll be having 2 to 3 months of postings during their DM days, and we used to get postings in clinical pharmacology as well, and they'll do LCMS and all those spectroscopy related experiments, and it's clinical pharmacology is one subject, and we used to have drug metabolism related studies and pharmacogenomics. As I said, we used to do a lot of gene analysis, extract the DNA by ourselves manually or maybe kit method, and do RT-PCR, find out the gene expression and so on. And we used to have toxicology related experiments. We used to have a lot of animal experiment that we used to call experimental pharmacology, and we had essential research methodologies as well. We used to have protocol writing trainings, like so these are the different departments, or not departments, these are the different branches inside pharmacology where any MD pharmacology students will get trained under these different you know areas.
Right, sir. So, sir, we have been talking quite about research from the starting of this podcast. So now let's address this. So, what are the different what is the approach for the research projects or thesis works during MD, and how it is different in central institution versus the college, state colleges, and what tips would you give for someone who is looking to opt for a good research topic for their MD pharmacology thesis?
Yeah. So it's another very interesting question. Probably I'll take a minute to explain this particular part. So research is really, really, not so developed in India, I should say. Very few students and very few institutions support research, and they encourage students by doing a lot of activities. I'll just take my own example in JIPMER. JIPMER used to give intramural fund close to 1.5 to 3 lakh per student. For any MD student, if you submit your project and which requires lot of consumables, or maybe like couple of things for which you need to spend money, JIPMER used to give money. Like they had paid me 1.5 lakh back in 2017, and now I heard people will get 3 lakh and more than that. And if you still need money, you can always reach out to ICMR or different bodies, government bodies. Share your project with the help of your guide or any professor from your department. And if your you know uh, project is really good, they will fund up to crores. I've seen my senior who did a research, RCT, a randomized clinical trial, comparing couple of diabetes molecules, and they got ICMR funding, and amazing. He published in nice journal, and it gave him a lot of experience. And that's how I quote it. Especially in central institutes, they will give you intramural funding, which will help you in purchasing. Especially for me, when I was doing pharmacogenomics, you need to buy SNPs. SNP means gene kits, and you need to buy
Right.
phenol. You need to buy different chemicals to extract the DNA. You need to have buy syringes, lot of different things, and to run your RT-PCR machine, to run your LCMS, you need different reagent which are really, really costly. Single gene SNP kit cost 25,000, and if you are having more genes to study in your research, you need to spend more. Likewise, and while doing this research, you will understand what is the methodology. Like, they will ask you to pick the topic initially, rephrase the topic depending on different methodologies or headings. You will have to prepare the protocol properly. While writing the protocol, you'll understand what are the different areas you need to give focus, how exactly you should write review of literature, how exactly you should utilize biostatistics, which biostatistical test should be used in your research. While you apply your own experience or knowledge to do your own research, you will learn a lot of things. And that's how research should be, and that's how research is going on in some of the very few institutes. And few of the institute, I don't want to name them, but though they are central institute, they don't provide intramural fund, but they will ask you to spend your own money. And especially in central institute, you'll get very good stay fund, right? They will pay you as close as any pharmaceutical industry which pays you in the beginning. And when you're getting that much money, they will expect you to spend your own money, like 1 lakh, 1.5 lakh. Sometimes because of this constraint, they will take some observational study which is already done, and with a very, they'll just copy paste from different things, and the quality of that research will go down, right? That's how it happens in some of the institute, and especially in state government college, that's where the limitation is. Very few faculties, they'll try to explore that research options, and this is a mandatory thing to achieve your degree. And there'll be marks for your MD thesis as well. But in state government colleges, this is just a tick mark activity. Sometimes I have seen some of my friends who have done it from BM Bangalore Medical College or any of the top Madras Medical College or other colleges, KM Mumbai, doing amazing research, publishing in a very good paper. But some of the students who come from very remote colleges where they have done MD pharmacology, they will just copy paste from different things, and they'll not publish it just for the sake of completion. They'll do it without understanding the basic fundamentals of research. So that's how it is happening in Central Institute and other colleges where research has taken a backseat. So that's why I highly motivate anyone who is willing to join pharmacology to choose a good department where all these facilities are there. If not, please don't join. Please don't waste your energy. Don't waste your valuable time in joining some colleges where you don't have anything, and then you'll, for the sake of completion, you'll complete, but you'll miss a lot of things. You'll definitely not enjoy when these things are not there, especially in pharmacology.
Right, sir. So that was a very nice insights about this thing. So, sir, like how much interaction does a pharmacology resident have with clinician, lab work, or the ongoing drug research or
Yeah,
trials?
I told you actually. So pharmacology resident, usually, especially in some of the college, they don't you know do any kind of uh, discrimination like non-clinical or something. And in especially in Jipmar, I used to see a lot of medicine professors coming to our department, cardiologists coming to our department, asking for students to do research in their clinical setup. We used to uh, often collaborate with these clinicians in patient care settings and participate in drug trials, engage in laboratory research to deepen their understanding of drug activity. So we do a lot of collaboration, and there will be a lot of such opportunities wherein which you will be interacting with clinicians and laboratories. I just told you my own experience. In pathology, they had a hematology lab, they had given me one space, and especially weekly 3 days, I myself used to go sit in front of the facility, and that machine was hell expensive, and they just believed me. They trained me to use that machine, and couple of reagents, like for example collagen. If to buy small 1 or 2 ml of collagen, you need to spend 20-25,000 rupees. And just imagine, when I'm using those reagents, they'll trust you. And especially when you are doing those assays by yourself, you will learn a lot of things. You will come back and read how not to use, how to troubleshoot, talk to pathology residents, talk to pathology clinicians, or talk to technicians. So likewise, you will interact with clinicians as well as labs in the hospitals or in the college setup a lot. That's why pharmacology is like, I always think pharmacology is like a foundation. I forget about anatomy and biochemistry and physiology. Yes, they are all basic foundation, but pharmacology is like a connecting heart which connects all the subject you name. We study about OBG drugs, we study about orthopedics, whatever rheumatology drugs are there, everything in detail. And we learn all the pediatrics, medicine, everything. You will be master of all Only thing is we are jack of none because of lack of
Right.
clinical experience. But if you are someone who loves a thing, probably you will go to clinical departments, talk to a couple of faculties, talk to other residents from different departments, clear your doubts, see the patients, see the drug actions in them, and follow the patients to look at the safety, and involve yourself in antibiotic stewardship programs to understand resistance, and then definitely will love it. Pharmacology is, it's like a beating heart of any medical college.
Yes, sir. So that was a very nice summary line. You have mentioned that pharmacology is the beating heart of all the branches of medical science. So, sir, for someone who is not sure or is not well aware about MD pharmacology as a career, but is thinking to pursue, or someone who is sure but also needs some guidance on it. So, what do you think will be the advice for the MBBS student who is considering MD pharmacology, but unsure if that is right fit for him or not?
Yeah. So basically, passion. If they have the passion to study, basic drug sciences to hardcore research methodologies and animal studies, you need to have patience. And beyond all this passion, just for the sake of completion or doing some PG, don't do it. If you are having the passion towards these core areas, then it is up, it's a subject for you. And here you will have to spend a lot of time in preparing. You need to prepare your own slides before you teach undergraduate student. When you are teaching 150 to 200 brightest minds in front of you, especially in central institutes, most of the MBBS students will be very very talented and they are very fast. Or maybe in any of the colleges, most of the MBBS students, they are there for a reason, right? So they'll be very talented. And when you're teaching them, you need to be you know expert of the field, right? So you need to prepare a lot before your lecture tomorrow. You need to sit and do the work. It's not like next day morning you'll wake up and you will go there and blabber something and make a mistake. And this is a holy subject. You should not make any mistakes. You should not forget, standing there. You will, you will remember, okay, metformin, sulfonylureas and something, and then you'll forget SGLT2 inhibitor, what are the drugs which comes under it. You should not. And those drugs should be there in your fingertips. Likewise, you need to have hard work, dedication, uh, patience, determination. Beyond all this, you need to have passion. If you have passion, I should, or I'll always say, this is one subject you should definitely explore. And if you are someone who is willing for a different lifestyle, then this is one such subject for you.
Perfect, sir. So now we have almost tackled about the residency life in MD pharmacology. So, sir, I know we have been talking about the positive sides of this branch, but I am definitely sure there will be challenges of this branch also. So, sir, for our viewers, can you address some of the most common misconceptions that people have around MD pharmacology?
Yeah. So a lot of people believes it is solely about drug interaction, and only we discuss mechanism of action and study all the side effects. We always do that in undergraduation itself. Then what are we going to do in MD? So that's what they have, that misconception. But believe me, whatever we studied in undergraduation, that is just one third of it. And another two-third, we learn a lot of advanced pharmacology, a lot of new things which is happening, monoclonal antibodies, off-life extension technologies, and converting route of administration. For example, back in those days, nobody believed that we can give protein tablets, or maybe like protein tablets which is basically a protein like insulin. You can't give oral insulin, right? But right now we have oral insulins, or drugs which acts through oral mechanism. A lot of new technologies are coming up to avoid proteolytic damage, to extend the half life. Those advanced things and all we learn. But a lot of people have heard there is a misconception that we only talk about academics lectures and boring drug interactions, and we never do any kind of clinical discussions or something. But Believe me, those are misconceptions. There will be clinical element to it, there will be research element to it, there will be academic element to it, and there will be a lot of recent advancements into it. Whatever happens in the medical science, it will come to pharmacology first, then it will go to other clinical subject. That is how I see pharmacology as.
Right, sir. So, sir, what are the different challenges that a resident face during their course or in their initial phase of the career?
Yeah. So I see challenge. You will have to juggle multiple things. You will definitely do not have any kind of night duties or any overnight shifts or anything, but you need to sit in front of laboratories or lab devices for long time. For example, if you are running RT-PCR, you need to sit for 6 hours, 7 hours, and long hours you will have to sit in front of it, and there'll be pressure as well to complete your thesis on proper timeline. You can't, if you're not getting patient, there'll be a lot of pressure on your head, because you will be utilizing intramural fund. You are accountable, for that research. There'll be a lot of pressure, and you need to while doing all these activities, you still have to present your journal clubs, present your critical thinking, present your debates, and take multiple classes across specialities. You'll be going to nursing colleges to take pharmacology class for them. You'll go to different department or building to take this. So you need to maintain all this, and these are different responsible things, and this will be a challenge in the beginning, but once you understand how things are and how exactly you need to manage this, then believe me, it will be a smooth sailing.
Right, sir. So, sir, you have already told us about there are multiple things that we need to take care of during our residency. So, how were you personally able to balance all these things during your residency?
Basically, you need to prioritize few things. For example, if there is an MBBS class where you will have to take, you need to prioritize it. And if there is any research related technical things which is going in a laboratory, delegate it to appropriate people, or maybe talk to a technician, take or seek his help. When there is 2 3 hours of gap, or when there is a machine which runs for 3 to 4 hours, or centrifugal machine which is running for some time, you need to manage your other work. So likewise, you need to have a good relationship with your guides or mentors, and having good relationship with your co-colleagues, and things will be very much smooth. And especially, I had very good co-PGs during my MD days, and we used to have that balance. We used to help each other, and that's how I managed to balance my research, academics, and even in career. So you need to prioritize things. That's my take home message, especially for this question.
Right, sir. So, sir, from transitioning from academic to industry, that can be a tricky at times because there are the different skill set that is required for the different things. So, what do you think, like how someone can go through this, how they can develop these skills and be smooth at their work?
Yes. So, especially it's not easy. I'm someone who did both my UG and PG from, government setups, like UG from state government college and PG from central government. I had seen a different working atmosphere there. And as soon as I entered multinational company, like be it Novo Nordisk or any company for that matter, it's a different word, right? Like you need to adapt very quickly. So adaptability is one thing. You need to understand the business mindset, and you need to improve your communication skills, and the transition is very important. For that, I should say you should be flexible, and you'll be working with colleagues who are not doctors, especially in industry. They'll be MBA from different colleges or IITs, or they'll be from IAMs, very talented people. And you'll be working with sales colleagues who are degree holders. Sometimes they're not even from life sciences, they'll be from different background, where you have to teach them medical science in a very simplified language. And you need to have a very good network and do the internships here and there before you join. That will definitely harness your skills. So this is how I transition myself smoothly from academics to industry. I should say the single skill you need to possess, especially to have a better life in industry, is adaptability. You need to adapt very quickly and very efficiently, then it will be much easier for a good transition.
Right, sir. Sir, also to tackle few more common skills, that is communication skill, evidence-based medicine skill, and continuous learning. So, how do you think are this important in this field?
They are pretty important, especially, I told you, we'll be traveling a lot, we'll be communicating, papers or scientific articles to HCPs, where you need to, communication skill is one thing, but how exactly you will simplify medical, numbers into the communication, which is easy to understand for the doctors. Some are very senior doctors, they don't have time, and some are very very young doctors who have a lot of time and who have a lot of eagerness to learn, hunger to learn. You need to balance it, and those soft skills are very very important. Communicate, in clinic communications, to communicate any scientific papers easy and efficiently to doctors. That is very important. And when you are presenting in front of, 15 20 doctors, or maybe 50 to 100 doctors, presentation skill is another very important, I believe. How exactly you will, take on, how exactly once you take off, how to manage the tempo during the presentation, how exactly to give analogies to create the interest among the audience, and how exactly you need to conclude, how exactly you need to answer the queries which you get post your presentation. All these things matters. And as I said, communication skill is one thing, but having multiple skills on the go, you will learn a lot of things from different people. You'll be meeting a lot of dynamic people inside the industry or inside the academic. Absorbing good things from those people will definitely help you in, uh, you know sharpening your skills there.
Right, sir. So I think we have pretty much discussed about the challenges of MD pharmacology. But sir, the very important segment of this podcast will be talking about the newest technology, that is AI. As we have seen artificial intelligence shaping every career aspect. So let's talk about AI in AI changing the dynamics of pharmacology. So, sir, how do you see AI influencing pharmacology today, especially in areas of drug discovery, clinical trials, and data analysis?
Yeah. Probably I'll not restrict myself to pharmacology here, because AI is one tool which is helping medical sciences overall. I'll just take one small example. There, in Germany, they were trying to implement AI into radiology. There were 95 radiologists who were best radiologists across Germany versus one AI system application to, report a scan. The accuracy rate of radiologist, and, as I said, they were all best in their business, it was close to 90 to 91%. And the number of AI, it was close to 99% accuracy and, efficient. Just imagine, in a single go, AI took the job of 95 radiologists there. So that's how AI is coming into the field. And in pharmacology, as you said, drug discovery, I gave you one such example: high throughput screening, HTS. After the AI, HTS has become much easier and much efficient. And, it has shrunk the number of years which is required to develop a drug. In a typical terms, we say for any drug to see the light, or from bench to bedside, it typically takes 10 to 15 years, or you should say like 15 years. Like, for example, whatever drugs we are using, for example, I'll take my own example, semaglutide, which is GLP-1 analog, a receptor agonist. So this semaglutide, we started the research way back in 2009 or 10, and right now it is 2025. India launched semaglutide couple of years, not couple of years, like, sorry, 2 3 months back. And which means 15 years back. In 2009 or 10, there was no AI. And if you implement AI into clinical drug discovery, you just believe me, this 10 to 15 years will become 5 years. And 15 years means close to 1.5 to 2 billion US dollars you will have to spend on the drug to recruit manpower to do the clinical research across the world in multiple countries to getting the approval from the regulatory authorities. 15 years, $2 billion. Now AI is there. AI has become very cheap these days, and with the help of AI you can reduce the cost, you can reduce the timeline. Just imagine the effort which is getting saved here. So that's how the influence of AI is amazing in pharmacological fields, be it clinical trial or any of the basic pharmacology, pharmacovigilance or safety signal evaluation, everywhere it is helping us. And this is definitely bringing that comprehensive patient analysis, and it is reducing the manpower, it is reducing repetitive things. For example, we used to have people to do data management. There is about 15, 20 people to sit and delete couple of things, create the excel sheets and do that, right? Now one single AI supercomputer is enough to do 15 people's repeated work, and it will also not make any kind of simple, silly errors. There will be errors, and to manage that small errors, probably you need to assign one person to review it once in a while. But believe me, it has reduced and it has made the life easy, especially in pharmacology and especially in pharmaceutical sciences. AI is the
All right.
future.
Yes, sir. So I think we have covered almost everything about how AI shaping pharmacology. So, sir, what do you think are the biggest challenge about AI in pharmacology?
Yeah. So regulation, I should say, like nobody, we don't know like exactly like how that machine turning tool has generated the data, and without properly checking the data which has come out of AI, you can't use it. So that's a huge limitation. And ethics is another thing. Whenever things goes wrong, you can blame a person, you can punish that person, but you can't punish the AI, right? Like those are the challenges which has to taken into consideration before you implement AI into any of this field. And if it threatens the life of a patient, then it is very difficult, right? So that's how I see it as a challenge. Regulation is one thing, and reviewing is another thing, and ethics part is another thing. Probably going forward, we need to work on it and getting the proper approvals. And another thing is data safety. You never know, like AI, for example, I'll be using chat gpt sitting in my home here, and chat gpt is basically it's a US company, like what is that company name? OpenAI. That is there.
Yes,
I will say challenges with respect to AI is data accuracy.
yes,
You never know how accurate the data which is generated out of AI. And you need another person to review it. You definitely need a human touch to AI. Without human touch, it is not perfect. And other thing is ethics and data safety. You never know, like once you use AI, whatever you enter in ChatGPT setting in Philippines, which can be easily read by OpenAI fellow who sits in some part of US. So you never know like how safe it is. How is it encrypted? Is it safe? You never know. Once we get clarity, once we hold AI as a responsible person for any mishaps, then probably things will be fine. I see these are the limitations with AI right now at the moment.
yes, sir. So, sir, I think we have almost covered everything about pharmacology, AI, and everything. So, the one of the important segment that for which we got you on this podcast is to discuss your journey, how you got from MBBS to medical to your current post as a medical manager. So, sir, let's talk about your personal journey. Why did you choose MD pharmacology? Was it something that you wanted, or did it happen by chance?
It happened on the go actually. So when I was doing undergraduation, I had never thought I would be choosing non-clinical subject for sure. I because I never really liked it, because I never really liked the teaching of some of my teachers back then. Though they were really good, but I never really liked it, unfortunately. But I happened to love pharmacology because of one teacher, as I said, in during my Thrissur PG entrance exam preparations. So that's how I chose pharmacology and I landed here. And I never regret it so far, and I really enjoy it. Right now, I am really thankful to my decision back then when I chose pharmacology. So that's how I chose pharmacology, I should say.
Right, sir. Sir, as you have been, you had pursued your MD pharmacology from one of the top institute of India, that is JIPMER. So, sir, how was this experience for you, and what are the biggest takeaways from those years?
Amazing, actually. I really loved those 3 years. I don't know. I always feel like if I get a chance to time travel, those 3 years were amazing. Like I had amazing time, good friends. Pondicherry was amazing. Beach city. Cost of living was really good. Those 3 years were really, really good. I thoroughly enjoyed it, and especially in department also, we had amazing training. I had a professor who was a Marathi, actually, Doctor DJ Shavade. He retired, immediately after my PG days. He was one of the greatest professor, I can have. He was my guide for my research. Amazing, he was like walking Goodman and Gilman, like amazing knowledge. And research opportunities in JIPMER was amazing. I have seen people doing, toxicology studies, cell culture studies, and bioassays, doing randomized control trials, animal studies, multiple research opportunities. And overall it shaped my clinical and um, my analytical skills, I should say. Overall my experience was really good. I should be forever thankful to Jipmer, and that brand is amazing. And as soon as I entered Novo Nordisk, I still feel, that is one important aspect which helped me in getting this job, and which helped me in, where I am right now.
Right, sir. So, sir, after your MD pharmacology, you joined Novo Nordisk. So, you have been going through the multiple position in this organization. So, sir, can you walk us, for our audience, can you walk us through the different roles, what that roles they meant to be, what were your responsibilities, and what the role has taught you?
Yeah, sure, definitely. This is another interesting part where I'll love to explain. I joined as regional medical advisor based out of Bangalore to support hemophilia team as well as pediatric growth hormone team. So my role was to meet hematologist, clinical hematologist, to talk about hemophilia, to help them understand, the basics, because hemophilia is a very less understood disease in India, right? Like other than knowing hemophilia as a Christmas disease, nobody knows, beyond it. It's a bleeding disorder, deficiency of factor 8 and 9. That's all I knew back then. But after I became RMA, I started going through the science of hemophilia, available drugs, what are the important factors, and everything, which taught me a lot. And I traveled across India. I don't know, like, except 3 or 4 states in Northeast, like Manipur, Mizoram, or Nagaland. I have been to all states in India, all cities, most of the cities in India. Especially 2021, post pre-COVID and just after COVID, I traveled a lot. I involved in launches, drug launches, multiple airports. Uh, you know, mm, mm, I don't know how to explain that. That was amazing. I saw different cultures, tasted multiple cuisines across India, and interacted with a lot of people. And I just loved it. And that's where and meantime, I was also getting promoted. I became medical advisor immediately. I started working more into strategy, and, prepared a lot of communication materials, and I presented multiple articles, and I presented, protocols to DCJ to get the approval for clinical trials. I supported a couple of clinical trials in sickle cell, And then I got opportunity to do a short term assignment in clinical trial team as clinical medical manager. That's where I, the most beautiful part, most satisfactory part of my career. It was just briefly 1.5 year, but I was tasked with one phase 2 study on sickle cell, where we were facing difficulty in recruiting the patients to that clinical trial. And there is one upcoming drug, probably it will come to market in another 4 to 5 years in sickle cell. I traveled across tribal areas where sickle cell prevalence is very high, especially in Nagpur, Gujarat, Wayanad in down south, and Chhattisgarh, Raipur, and different places, West Bengal. I interacted with couple of tribal people. I interacted with couple of, honest doctors who are working in tribal areas to make the life better for these patients. And we successfully completed the recruitment, and we successfully, this trial is still going on. That is one hell of an experience which I really loved. And that's how I experienced, clinical trial very close, up close. I presented multiple protocols to DCJ members, CDSCO members. I got very good positive feedbacks. I was involved in protocol presentation to multiple doctors across India. I was there to explain inclusion exclusion criteria, to clarify a couple of medical queries in which investigator had to ask. I got an opportunity to travel abroad, to learn about sickle cell more. I went to London, one of my dream city. Like, I told you, like, I'm a huge football fan. I follow a club called Chelsea Football Club, which is based out of London. All those years, when I was reading undergraduation, or whenever, I always dreamed of going to London, watch Chelsea playing in London in Stamford Bridge, our own stadium. It all happened because of this particular role. I got a chance to visit on a official trip. I am just forever grateful to this particular part. And I got a chance to visit Canada to attend one conference in hemophilia. So those are the parts, important areas in which I thoroughly enjoyed, learned a lot of things, met a lot of people. Professionally and personally, I grew. So that's how my career progressed. And then I got an opportunity to become manager, like a leader, I should say, like. And then I came back to medical affairs again, cardiometabolics. And I had a team of RMS reporting to me across south and eastern part of India, starting from northeast, West Bengal, Odisha, Bihar, Jharkhand, AP, Telangana, and all southern states. I had RMS in each of these states, and I had to take care of insulin's portfolio, do the meetings, and travel with them, and to guide them how exactly they should work, how exactly I work during my days. I, imparted some knowledge and trained them. I'm still doing that right now. And now I am more or less working for obesity right now from insulin. So likewise, I worked in multiple areas, learned a lot of things, you know, uh, got trained by amazing managers, and met a lot of dynamic doctors in the field, learned in a professional way. And in personal side, I went to different states. I've been to most of the important cities in India, tasted the cuisines, see the culture, interact, and know more about the history of that place. It has been a more satisfactory thing so far. It's been just a 6 years in the industry, but this is how my career progressed inside the Novo Nordisk. Yeah.
Right. So that was a very diverse experience that you mentioned, right? From the work to the traveling and everything. So I think all the viewers who will be listening to this, they will get more better idea about this, what this domain has to offer. So, sir, now it's one of the interesting segment that we call as the Medhustlr dose with Dr. Ranjan. So where I will be giving you some questions, and you just have to say one or two words for it, whatever comes to your mind. So, sir, are you ready for it?
Yeah, yeah, definitely. Go for it. Let's go.
Okay, sir. So, if you had to describe pharmacology in one word, what would it be?
It's dynamic.
What's one underrated skill every pharmacologist should develop?
Adaptability.
Perfect. What's the biggest myth about non-clinical branches you would like to burst?
Lesser touch or patient care.
Perfect.
That is a huge myth.
Right, sir. So, what's one thing from your Chipmer days that still influence how you make your decision today?
Collaborative learning and shared knowledge.
Perfect, sir. So, between writing a research paper and making real-world patient impact, what excites you more?
For me, definitely not writing a research paper. I'm not. I don't have much patience right now, so I would choose patient impact.
Perfect, sir. So, sir, name one drug discovery or innovation that truly inspires you.
Obviously, my all-time insulin. Insulin has won 6 Nobel Prize so far. Highest number of Nobel Prize, and it is known as $1 patent drug. And the person who invented is the youngest Nobel laureate, Frederick Banting and Best, who is an intern like you, Best, who supported Banting. So probably beyond this call we can connect, and I'll this is one inspiring story I always explain to my students or my friends. So I always say insulin, and there are multiple things, penicillins and so mRNA vaccine and so on. But I always keep insulin in my heart, and even my company is known for insulins. It's been working in insulin field for last 100 plus years. Even our founder won Nobel Prize for it. So I always choose and say insulin is my inspiration, behind pharmacology.
That was a very interesting fact. Sir, if you weren't pharmacologist, what career would have you chosen?
I should say, if it is not medical field, probably I would love to become civil servant, probably IPS officer. If it's a clinical practice, probably if it's a medical field, probably I would have become surgeon, orthopedic surgeon more precisely.
Perfect, sir. So, sir, what's the most rewarding part of working in the pharmaceutical industry?
So here you will see patient outcome very quickly. Like for example, I am working for obesity right now, and we have semaglutide molecule which you can see. And whenever we go and meet doctor, they will say, one of my patient lost 20-25 kg in last 6 months thanks to your drug. You'll feel so satisfied, right? So I was in Hyderabad 2 days back. I met a doctor, nephrologist, and he just told me he had a patient initially 125 kg. She used to come in a wheelchair, and he started semaglutide. I'm not doing advertisement for semaglutide, but after starting oral semaglutide, that patient lost close to 40 plus kgs. Now she is 72 kg. Now she can walk and come to see him in hospital. When you hear that story, and now he loves semaglutide and he's prescribed it to a lot of patients. So I felt very contentful, and I felt really happy, and which made a difference, especially in terms of patient outcome. So that's where it's a very rewarding part of pharmaceutical industry. And beyond this, personally, I should say traveling as well, because I love traveling, and which gave me amazing experience in last a couple of years.
Perfect, sir. So, what's a leadership lesson that you have learned at Novo Nordisk and stayed with you?
I should say empowering your team. When you upskill and if you give confidence to your team, they will become much more versatile and much more impactful in their work. So I should say empowering my team is a big leadership lesson which I am learning, and I'm still learning on the go.
Perfect, sir. Sir, and lastly, what's your quote or mantra that keeps you motivated when things are tough for you?
I don't know. I'm not able to recollect any motivational statement right now, but I should say I'm a great believer of one of the 12th century, 14th century, I think, a reformer called Basaveshwara, from northern Karnataka, and he worked against caste oppression in those times, and he said, "Work is worship." In Kannada, we say "Kaya kave kailasa," means worship the work which you are doing, so which always kept me motivated. And you know the progress will come if you dedicated and if you show that dedication towards your work.
Right, sir. So, sir, we are almost at the last segment of this podcast. So, for someone who is deciding MD pharmacology is right fit for them, so what are the final advices that you want to give to them?
First, they should reflect on their interest, on especially I said drug research, science, and basic medicines, and talk to your seniors, talk to your peers, and try to find someone or some senior who have done pharmacology PG from your respective region. Talk to them, and then you decide and analyze your own interest. Take a paper, write all the positive and negative things, and then you enter into that subject. Don't just haphazardly take a decision, and sometimes you may not like it. So that's how I say. That's my advice.
All right. So just to summarize the whole podcast, first of all, I would like to thank you for being part of this series, ruling in series, where we are for our audience, where we are bringing such insightful and impactful journeys of different doctors who have been going to different residencies and have been doing great in their domains. So, sir, your journey from getting MBBS from Shimoga to MD pharmacology in one of the prestigious college of India, that is JIPMER, Pondicherry, and now as a medical manager at Novo Nordisk, it truly highlights how diverse and impactful this field can be. And I'm sure that listeners have gained a lot of clarity from your story about MD pharmacology and pharmacology as a career. To all our listeners who are listening this, thank you for tuning in through the podcast. This is our channel Medhustlr, where we decode healthcare for you, and this is a part of our ruling in series. We are planning much more episodes. After that, episodes in this series, we will be talking about different medical specialties. So for that, please stay tuned. And once again, I would like to thank Dr. Ranjan for being part of this show.
Uh, Thank you, Medhustlr team and Ame, for this wonderful opportunity, and which gave me, a lot of insights while talking here. And my take-home message to all of you is: embrace the challenge as a learning opportunity. Stay curious. Remember that every experience contributes to your journey as a healthcare professional. Don't restrict yourself to particular thing, and don't limit yourself. Explore multiple opportunities, and be adaptable, and be humble, and you will definitely achieve a lot of things in your life. Thanks a lot, Amai, and it was wonderful to interact with you. And I hope my suggestions or my advices will help your team and people who are going to watch this podcast. Thanks a lot.